Today's video is a little different, and I'm going to be slightly dramatic because we are going to talk about products I would never let my family use as a board-certified dermatologist. And just to be clear, this is not like an everything is toxic video. I'm not here to make anyone panic or to shame anyone. It's really to have an evidence-based discussion about products that are high risk and or low reward. And of course, I will not leave you hanging. I will give you great alternatives because I know after this video, you will want to throw a few things in the trash. If you are new here, welcome. I'm so happy to have you. I'm Dr. Sam Ellis. I am a board-certified medical and cosmetic dermatologist in Northern California, and I treat thousands of patients a year. And the goal with this channel is to really help you, if you're not my patient, deep dive on skincare, hair care, nails, wellness, so you can take the best care of yourself and make the most informed decisions about how you're going to do that. If you like that type of content, make sure you give this video a thumbs up and also double check, make sure you're subscribed to the channel. Okay, let's start with a product that seems harmless. And in fact, I used to recommend this product myself as a dermatologist, but I have seen the light, and that is powder sunscreen. Conceptually, this is fantastic. It's easy, it's lightweight, you can apply it over makeup. It just feels almost too good to be true. And that's kind of because it is. And as a dermatologist, I used to recommend it all the time because I was like, I will do anything to have my patients wear SPF more consistently. And this just gives me another tool in my toolbox. However, the problem lies within the application. A sunscreen is only protective and only delivers the SPF that's on the tube or the bottle. If you put enough on, for example, to get an SPF 30 powder sunscreen to actually protect you with a sun protection factor of 30, you would have to put on a thick, visible layer of powder on your skin. And nobody does that. Most people don't even put on 10% of what is required. So you're not getting any real protection from a product like this. My maybe one exception to this is using it in the part of your hair that is an area that can be really hard to apply other sunscreens. And that's also an area that you can be very generous with the powder without it creating a cosmetic issue. So I do find if you can put a good amount up there, you're probably getting some protection, but you have to understand that you are likely not getting complete protection. And I would push for you to just put a hat on, but I know that's not always appropriate. Another product I would never recommend to a family member is those Atom skin tag removers. These are typically sold as little freezing devices that you apply to a growth with the hope that it will damage the growth and make it fall off. But I think these should be illegal. I get why people buy these. They see a bump on their skin, it's cosmetically unsightly, and they want it off in a quick and affordable way. But if I can tell you anything from being a dermatologist for 10 years, is that people are not great at identifying the type of bump on their skin, and you might be chasing a skin cancer or something that's not appropriate to remove in that fashion. Let's say you were accidentally to remove a skin cancer that way. You haven't actually removed the skin cancer. You've only removed the top of it, and it can have roots. It can go deeper. It can metastasize, affect your other organs. It could kill you. I'm not trying to be dramatic, but these things do happen, and new skin growth should be professionally evaluated before they are treated. So safety is one aspect, but the cosmetic aspect is another. So these work by freezing the surface of your skin and causing damage. And on average, these things get to about 20 degrees C, which is a lot. But when you compare it to the devices we use in our office to freeze things off, those get to 196 degrees. So they are much, much colder. And the reason I want to make that distinction is because when you have something that's not super cold and you're using it to destroy something on your skin, like these things you buy at the drugstore, you have to apply that cold spray for a very prolonged period of time to the skin. And while you may be damaging the growth that you're targeting, you can also cause unnecessary damage to the skin around it and cause things like discoloration or permanent scarring. And I particularly warn about these when it comes to the cosmetic aspect if you have a deeper skin tone, because freezing actually destroys permanently pigment-producing cells in the skin, so you can leave yourself with a light or white spot that is not fixable. In a dermatology clinic, we can remove these growths safely in minutes. This is not a DIY situation. The next skincare product that I will never buy, I will never recommend, is Neosporin. And this one actually surprises a lot of people because people have been using it successfully their whole lives on cuts and scrapes, and they've never had an issue. So what's my problem? Neosporin contains an antibiotic called neomycin, and over 10% of the population is or will become allergic to that antibiotic in their lifetime. And we see this all the time in dermatology where someone has been using Neosporin their whole life and then suddenly they're treating a cut or a scrape or some stitches after plastic surgery, and now they're getting this red, irritated, blistering reaction. They have developed something called allergic contact dermatitis, and it was totally avoidable. And I've talked about my dislike of Neosporin before, as many dermatologists on social media have, and usually the biggest comment I get is, but it worked so well for me. And one, that's great. I'm super happy that it worked well for you, genuinely. But the other thing is, you don't actually need Neosporin to heal wounds. Plain Vaseline Aquaphor will work the exact same way when it comes to efficacy, and you're not subjecting yourself to any risk. If you want your minor wounds to heal the best, we want to wash them regularly and keep them moist. So every day you're going to use an antibacterial soap to gently wash the area. And then you can apply your Aquaphor or your Vaseline and then keep it covered. Occasionally, we will recommend a true antibiotic ointment, but this is typically going to be for patients who are immunocompromised. For example, they might be on steroids or have diabetes or be on chemotherapy or have a wound on their lower extremity, for example. That's at high risk of getting infected. And in those cases, we will still never recommend Neosporin. We will recommend polyporin because it doesn't contain neomycin, and you can buy polysporin over the counter at your drugstore at Target. They just have a much worse marketing team than Neosporin. While we are on the topic of wounds, we should also discuss hydrogen peroxide, which is a no, never. I think people love it because when they pour it on, it bubbles up, it stings a little bit, so it really feels like it's working. But in addition to killing bacteria, it is damaging healthy skin cells. So yes, it does disinfect, but it also delays wound healing, which can lead to a worse or more obvious scar at the end. In clinic, the only reason we keep hydrogen peroxide around is to get blood out of clothing. And if someone has a really heaped up, very crusty wound that they have not really been taken care of, we use hydrogen peroxide to dissolve all the skin around it so we can see the wound base. We are never using it for true wound care. Like I mentioned when I was talking about Neosporin, if we're taking good care of our wound, we just want to be cleansing it with soapy water. We do not want to be using hydrogen peroxide. Now, if you don't want to touch your wound because it's uncomfortable or gives you the ick, then I would recommend using something like hypochlorous acid. This is also very antimicrobial, but preserves the integrity of your skin cells and won't delay wound healing. Hypochloric acid is what's in my Prequel Universal Skin Solution. And although we did not make it with the intent of treating wounds when we get little cuts or scrapes around our house, that is exactly what we do to kind of rinse the wound out and prepare it to be healed. Okay, we are officially done talking about wound care, but if you have any questions about what we've talked about, definitely let me know in the comments. Now, I want to talk about a beauty product that I feel like has done a lot of people dirty over the last 5 to 10 years, and those are lash growth serums that contain a class of ingredients called prostaglandin analogies. I actually made a whole YouTube video dedicated to this about 5 years ago, but I don't know if I had any followers at that point. So we're going to revisit it. You will find prostaglandin analogies in a lot of very popular lash growth serums like Latisse, Grande Lash, New Lash, and that is because they are exceptionally good at helping you grow your lashes longer and thicker and darker. And if that seems too good to be true, it's kind of because it is. I even used to use them, but I have gotten older and wiser. And the problem with prostaglandin analogies is that they have a whole host of side effects that can be very problematic. They're a bit infamous for causing fat loss around the eyes, which can make the eyes appear sunken or hollow. It can emphasize dark circles. Aside from fat loss, they can also cause increased vascularity of the skin, meaning growth of new blood vessels. So often, people will find that when they use these really consistently, the margins around their eyelashes become red or purple. And if those two things aren't bad enough, they can also change the color of your eye. They can lead to drooping of the eye, and they can cause hyperpigmentation around the eyes, basically none of the things people want. So to me, if you are using a lash growth serum with prostaglandin analogies for a cosmetic purpose, the risks far, far outweigh the benefits. And I should say there will always be exceptions to this rule. I actually have patients in my practice who have been using LET for over a decade, and their skin looks totally fine around their eyes. They have not been subject to these side effects, or at least not in a way that's negatively impacting their cosmetic outcome. So if you've been using a lash growth serum with prostaglandin analogies, and I will put the names of the prostaglandin analogies here because they are not called prostaglandin analogies on an ingredient list, you should just check and see if you have any of these side effects. Do your eyes look more hollow? Do you have more redness? Because those might not be worth the trade-off of having longer, fuller lashes. Because within my practice, I specialize within hair loss. There are certain times I do recommend these types of lash growth serums because they are the most effective for regrowing hair. So sometimes I will have people use them in their brows because they don't tend to get the same side effects. I can have people use them at the front of their hairline. And also my patients who have alopecia are areata, so a hair loss condition where they lose their eyelashes. We often will have them use this to help them grow their eyelashes back, or to help my patients who are post-chemotherapy regrow their eyelashes after full hair loss. But the goal is that they are not using these permanently, just temporarily, while they are struggling with their condition. So if you do want to be using a lash growth serum because that's something that you struggle with, I recommend picking one that does not have prostaglandins. I recommend the brand Swede all the time. It's just one that I've seen my patients have a ton of success with. And I always mention, when you're putting anything near the eye, there is always a risk of irritation. So always keep an eye out for that. Also, if you use a lash growth serum that you love and does not contain prostaglandins, let us know in the comments. Now, when I was a little kid, anytime we wanted something to heal without a scar, my mom would have us use vitamin E oil on it. We would literally cut the capsule and smear it on. I have so many memories of this, and I'm still covered in scars. Vitamin E for scars is one of the biggest skincare myths out there, and it's not like, oh, we've been doing it for centuries, so continue doing it. They actually studied this to see if it was effective, and it wasn't. When, as dermatologists, we are counseling patients on how to take the best care of their scars, we do not recommend vitamin E. We recommend silicone. Silicone is the gold standard because it helps regulate collagen production. And scars are made of collagen laid down in a kind of irregular way. So when you regulate that process, you can improve the appearance of scars. And silicone has consistently shown that it is helpful for scars when used over time. I would have someone start using silicone on a potential scar once their wound has completely closed. We call that re-epithelialized, there being a full, complete skin layer on top. And then you can go and this is usually somewhere between like 1 and 3 weeks after an injury. And silicone comes in a variety of formats. So it's mostly about using the format that appeals the most to you. You can use a silicone sheet that you lay over the wound and leave on there for usually 22 to 23 hours a day, just changing it off when it starts to not be sticky anymore. Some people don't like that, especially for facial scars. So you can also use silicone gels. And at Prequel, we developed a silicone scar stick, which is really nice because you can massage it over the wound for just 60 seconds, 1 to 2 times a day. It's been shown to help with scar appearance. Silicone is most studied and is generally thought to be most effective when used within the first 6 months of a wound, but you can actually apply it on very old scars, and it's been shown to be helpful there as well. Once you've been applying silicone for 6 months and the appearance of your scar has completely plateaued, it has not improved anymore, then we would stop. The last product that we're going to talk about today that I would not use, I would not recommend to a family member or a friend or a patient, is stretch mark creams, things like bio oil, shea butter, cocoa butter. These really prey on a person's insecurity about developing stretch marks, but they have never been shown to actually be effective in preventing them, whether or not you get stretch marks when you are growing, whether that's because you're pregnant, you're going through puberty, you're putting on muscle mass, has so much to do with whether or not you have won the genetic lottery when it comes to that. And secondarily has to do with how fast your body is changing. There's some pretty weak evidence to show that if you do kind of prolonged frequent massage, that may help with the development of stretch marks. So if a pregnant person is already going to be massaging their belly with cocoa butter or something like that, you might as well do it for 15 minutes to see if you can get some benefit out of it. Once you have stretch marks, the things that have the most evidence behind them are hyaluronic acid. So you can get a hyaluronic acid serum at the drugstore and prescription Tylenol. And as a reminder, you cannot use prescription Tylenol when you are pregnant. So that is something to do postpartum. When stretch marks are new and red, we can laser them in the clinic to help them disappear and shrink. And even when they are white or silvery, microneedling and other lasers can sometimes be helpful as well. If you want more details on how to treat stretch marks, I have a whole YouTube video dedicated to it because I know it's a concern that a lot of people are curious about, but save your money on the Miracle Stretch Mark creams and oils. So these are the products that I avoid as a dermatologist because they either create more problems than they solve or they're just not worth the time and effort. Which one of these surprised you or caught you off guard? I hope you enjoyed the video and I hope you learned something. If you did, make sure you give it a thumbs up and you're subscribed to the channel, and don't be afraid to share it with a friend or family member. Share the love. As always, thank you so much for being here, and I will catch you in my next one.